home is to assign somebody who lives with you. If you live alone, it's you, as sort of the warden, controlling who's coming in and out of the house. If somebody comes in that you know has just been gotten out of the hospital with a gastrointestinal virus, or a child that's just been home from daycare for 3 or 4 days with a high fever, they have the best intentions, they wanna come see you, but it's not best for you to be exposed to those kinds of things when your counts could be compromised. So in general, you're safe to be up and around and go out and enjoy things and do things and visit with your friends and family. If there comes a time where your white blood cell count is dangerously low, we hold your chemotherapy, we will give you what we call neutropenic precautions, meaning you do not have enough white blood cells to fight an infection. We give you a mask, we tell you if you're gonna be out in the mall, you're gonna be out, in public, you need to be keeping that mask on. If you're in close proximity to people that you don't know. If you're in your house or you're in your daughter's house and you're with your family and everybody's well, that's fine. But if you're gonna be out places where you don't know who the person sitting next to you could sneeze on you and what they've got brewing, you need to be careful, okay? And we'll let you know that. If you get to that point where your counts are really low, we're gonna be telling you that, okay? So that's very important. Food preparation, another thing, another place that you could be, unknowingly exposed to some kind of infection would be in the food arena. Cook your food, don't eat raw food, which could have bacteria. Stay away from buffets. Buffets are wonderful, everybody loves a nice buffet, but you don't know who touched the food before it went on your plate. Feel free to go to your favorite restaurant that you like and just make sure your food is cooked. And same thing, it's farmer's market season, everybody goes and buys their zucchini on the side of the road, just wash it when you come home, that's all. Same thing with the bags of produce that you buy that says it's already been washed, wash it yourself. Okay, so those are just a couple of things. And basically what we're trying to do here is to get you through this treatment and have you have as normal a quality of life as you can. So it's important to us that you let us know if you're not feeling well and you're not able to do things you enjoy, and hope that we can tweak something and get you to be able to enjoy. Does anybody have any questions? It's a lot of information, and you're gonna go upstairs and get a lot more.
Yes. You said that her treatment, like today, she'll be in a seat for how many hours?
Well, I don't know, because I don't know exactly what she's getting today, so the nurse will tell
Yeah.
you.
Because she has, I think her tumor is on a nerve,
Okay.
so sitting for a long period of time
Okay,
is,
so I'm gonna take you upstairs and we're gonna go on a tour, and I'm gonna show you that there are some beds up there. So we have,
Okay.
most of the rooms have chairs, but there are some beds, and we have patients who are more comfortable in a bed.
yeah, that'd be
And we
better
have
for her.
some treatments that require a bed, so you will let your nurse know that you would like to be in a bed, and we'll try to make that work for you. Other thing is that the chairs that we have do recline, so I think we'll be able to make you comfortable. And we would let your nurse know ahead of time that you were asking to have a bed, and then hope that there was one available. Sometimes we'll have to start you in the recliner, and then when one opens, depending on the time, we don't like to delay you, but we'll make sure you're comfortable. The other thing is, if you're in the waiting room, this morning was a little challenging in the waiting room, because we had some staff issues, so we had somebody that was out sick, so everybody was trying to help everybody else, and you end up getting a little behind. So the rule of thumb up there is if it's 30 minutes past your appointment time and no one has come and spoken to you or taken you back or called your name, you can knock on either of the doors and ask for help, or you can ask Jesse, the greeter, the gentleman that just brought you downstairs. Sometimes it's him, sometimes there's someone else at that desk to help you, okay? And then we look you up. That's what happened with you today. Someone came back and told me your name, and we looked you up and found you. So don't be shy. If it's been 30 minutes and you're still sitting there and no one's come to talk to you, let us know and we'll give you an update. Sometimes the labs don't result quickly, the pharmacy can get behind, there are things that can happen that can sort of spiral and delay things a little, but I always say we're not always on time, but we're always good good at telling you what's going on, and that you can expect. So if that's not happening, don't be shy, knock on the door, ask Jesse, ask somebody who walks out to look and check for you, okay? Other thing that's important is there's a scheduler upstairs in the, both sides, the north and the south, and we always like for you to make your next appointment before you leave. So if you, when you're here, as soon as your medicine is here, we can release your next appointments while you're here. And your family member while you're having the chemo, or you can take the pump and walk to the desk, set up your next appointments, and then you can always change them if something comes up and that day doesn't work and you need to move it one day, or, either way. We can change it later, but we like when you leave to have your next appointment. So when you leave, when my patients leave me at the end of the day, I always ask, do you have your next appointment, and do you know to get in touch with us if you have a problem? And as long as the answer to those questions is yes, then I can sleep at night. But if somebody doesn't know when they're coming back, and maybe doesn't come back, or doesn't have an appointment to come back, or they don't know how to call if they have a problem, then I get worried. Okay, so those are important things. So we're gonna go up and take a little tour of one of the sides. I think I'll just go to the south side. I'll show you a room. I will show you where the nurse's station is. I'll show you that living room. And also in the, both of the north and south